have looked into my eyes. You have seen what I am, but still you're by my side, telling me I can't. And there are times I've caused you pain, and times I made mistakes. Somehow you use them all to make the eye you made. Oh, every good thing that I've done, everything that I've become, everything.
Good afternoon. Thank you for joining us. All About Us Teen Talk TV. We just want to thank you for joining us today. Make sure you check out our website for All About Us Youth Magazine. You can go to www.aaUYM.com. You can also now tweet us at CJ@AAUTV Radio. Today we have a very hot topic, and I want you to sit back and relax and enjoy. Again, if you want to tweet us and ask any questions, you can do so at CJ@AAUTV Radio. Today we will have Shayla to introduce our guests.
Welcome, Ms. Ross from the Outreach Development Corporation. Thank you for coming today. Tell us about yourself.
Okay, well, like you said, my name is Jamie, and I am a marriage and family therapist. I primarily work with teenagers at Outreach Development Corporation in an outpatient program that deals with teenagers that are using substances. I also work privately in Smithtown, and I deal with families with whatever issues they could be bringing to the table. They could be bringing school issues, mental health issues, substance abuse issues. And I also work with couples to help manage the family a little bit better. So I think today we're going to be talking about substance abuse, a lot of substance abuse in the teenagers. So we'll really focus on some of the treatment and some of the drugs that the kids are using.
Why don't you tell us a little bit about yourself, on how you became to be a family marriage therapist and how you came to be working in substance abuse?
Well, I went to undergraduate and I majored in psychology and sociology, and at that point I recognized that I wanted to get into, I saw a lot of problems stemming from families of origin, and I recognized at that point that I really like to focus on some of where the origins of issues came into play. So I went on for my master's degree at Columbia. There I focused more on, I did focus a lot more on the pharmacology of psychology, clinical aspect of it, and I decided to go then and specialize in marriage and family therapy in order to really get a good perspective on the family dynamic. So I went to Hofstra for my postmaster's degree. And then working at Outreach Development for almost, I'm there about 8 years. I've gone to extensive trainings and really specialized in substance abuse with teenagers.
Got you. Just out of curiosity, because you said something about working with teens in therapy. Are you finding that you are getting more teens stressed out over educational issues?
We do find that. We find that kids are really feeling that schools are becoming very overwhelming for them, not only the educational piece, but the social piece. So we're finding that a lot of the kids that are coming in also I say the outpatient, but it could be anything for family therapy or whatnot, are coming in with some mental health issues, whether it be as simple as ADD or ADHD, and finding the resources that really are fitting them in the school. So we do see that there is definitely a parallel between the social piece of school, the educational piece of school, and then kids that are coming in with struggles and disabilities that really need additional resources. So that's increasing tremendously.
Wow. Do you think that has anything to do with the new core system, or just the fact that they are finding it hard to adjust to the grade that they're in, or peer pressure, bullying, tactics. Is that what you're finding? I'm just curious.
I
That's
think
all
it's
I'm
a little bit of everything. I think you hit the nail right on the head when it comes to particularly the social media and the expectations for teenagers nowadays. I think, I know we're all very savvy with our Twitter and our Facebook and our
Yes.
iPads and iPhones. I think this also promotes a lot of stress for kids in terms of keeping up with the socialization and keeping up with those expectations that everyone is going to be a part of that. And the social stereotypes and stigmas that kids have to attain, which is in this social media. I think the bullying, we're finding a lot of kids that are bullied because of their differences and not being able to fit in, or some of their issues that they might be coming in with. And also I think the educational piece, I mean, I'm believing in New York. I'm not too savvy on the educational piece, but the core curriculums, the educational standard is increasing. So I think that is, kids are finding that very challenging, and especially with finding jobs nowadays with a certain type of education, they feel the pressure. So I think it's a little bit of everything, I think.
I know this is not our topic, but what would you say to someone who is going through that and they feel like they have nowhere else to turn? What suggestion would you give to them to do?
I think the first thing I would say is reach out for some support. I think family members are really an important key, obviously, as a family therapist. I think being able to attain your own expectations and to meet those expectations and know that you're going to go at your own pace. I think that's the best advice I can give any kid, is to stay at your own pace. And as long as you have the support around you, that you'll attain whatever you are trying to attain with people around you that are supportive. And if kids are really struggling because of those pressures, to definitely reach out for help. I think a lot of kids aren't aware of how many resources there really are in schools and outside in the community. So I think to reach out for support is the main.
Gotcha. I know that wasn't our topic today, but it was just a question
Sure.
that I had, because you had said that some children are coming in with stressors as far as education. So I was just trying to get an idea of what other topics we could address in the future. But today we're here to talk about drugs and alcohol. That is our topic for today. So Elizabeth has our first question.
What could parents do in order to increase their awareness and protect their teens from getting involved in drugs?
Okay. As I was mentioning before, I particularly think family is very important. So I think it's really important for parents and family members to stay involved with their teens. I know I was speaking with you a little bit earlier, and you were saying you were involved in some activities, and you're always busy. I think that's a really important quality of remaining away, or something that's going to protect you from staying away from drugs, is being involved. So my advice to parents and to family members is to get involved with your teens. Get them involved in the community. If it's not the school, it doesn't have to be. It could be out and just doing community outreach things or volunteer work. So I think that's really important. Another thing that I think is really crucial are, if you have the availability to, I know with working families it's hard, but family dinners. Family dinners, I think, create values and some consistency at home. Even if it's once a week, families get together and it opens up honest and open communication. So I think that's really important. I don't know if do you guys have some family dinners and sit with moms or dads or cousins or... Sometimes. It's important because you get to ask them how their day is, and then they get to ask you how your day is. And I think that brings awareness to issues that kids might not talk about and they keep with inside. One other thing I think I can go on about this, is parents should definitely be involved in their teens' friends and their parents.
Exactly.
I think it's important to stay... just even if it's a quick hello, how you doing, how are things going on your end, but to definitely increase that communication, because you can become aware through other sources.
Exactly. You know what I was going to say in this, when you were talking about family dinners, what I'm finding is that a lot of kids, they come to the table, and it's like, Mom, I'm on my way. Can you imagine texting your mother when we had social media and saying, Mom, I'll be down to dinner in 5 minutes? Can you imagine that?
I didn't have a cell phone. No, I couldn't. But I find that even going out to restaurants, I'll see everybody with their cell phones out or their iPads out, and there isn't that communication. So I think it's important to just acknowledge, even if it's for 20 minutes, just time to talk to your family members without all the devices.
Yes.
It would be a really good thing.
I agree. I'm sorry.
As a professional drug therapist, looking at trends from the 80s and 90s, what trend do you see repeating themselves today?
Okay. I think there are a couple trends. Now, I'm a child of the 80s, so I could say I'm probably not too savvy on what was happening then, although as tracking some of those trends, there are a lot of different, I'm going to jump right into the drugs. There are a lot of different drugs that have made comebacks in different forms. So I'm sure you guys have heard about the hippie times, right?
Yeah.
Okay, that was according to my parents and people a little bit older than me. I'm taking that as flower child time where there was a lot of LSD use, this hallucinogenic stuff. So the trends now they take different forms. What we're finding a lot of right now is that the LSD and the hallucinogenics have transformed into a use of something called a Molly, which is, I'm sorry, not Molly's, the shrooms. Shrooms are this natural, supposed natural sort of hallucinogenic that kids they're not going back to the acid. They're going more to this kind of trend. Also, drugs, they like to mix drugs in order to get the hallucinogenic effects. So I find that a trend is that a lot of the kids do want to come back to this place of hallucinogens. There's two other drugs I'm going to say are making comebacks. One is the ecstasy, which originated, I would say, more prevalently in New York, at least, around the late 90s, early 2000, where kids were using ecstasy. It was a club drug, and they were going out and they were dancing it up and having these euphoric kind of feelings. Everything was good. Now kids are finding that drugs could be harder and more potent, and they're using them. Those are called Mollies. And it's a higher potency of MDMA. So we're finding that that's a trend that has been consistent, although has progressed to something with higher potency. The other drug that we're finding has taken a different derivation or a different form has been the heroin. Heroin, where it used to be injected, still could be injected, although there's prescription pill use, which is very prevalent now. Some common forms of heroin or opiates would be Vicodins, Percocet, oxycodones, roxycodones. They call them oxys roxys. So these kids are using pills. Well, I say kids, but it could be anyone using pills, because pills is definitely, the prescription pills is the more prevalent thing right now. So those are some of the trends of the drugs and how they're kind of recreating themselves in today's society.
Wow.
Scary.
It is
Very
very,
scary.
very, very scary.
Very scary.
I just want to interject and ask the question. Are they also using cough medication?
Yes.
That's another thing that I was thinking about, because I saw it yesterday on my Facebook page. And they are now using cough medication.
Cough medicine, the kids actually have verbalized to me that a lot of these, and I'm saying rappers because a lot of the rap music is referencing sort of drugs or types of drugs. And the one thing that they are referencing in certain types of rap music is this cough medicine, or they'll call it syrup, or syrup, and lean. And this lean, I was going to go into that a little bit as well, is a mixture of different drugs. Something like cough medicine with alcohol, a candy and a juice would be a lean. And kids are using this. Is very dangerous. You don't know the quantities of what they're putting in it, and it could be very fatal.
Wow.
Yeah.
Oh, yeah. Okay. I'm sorry, because Lil Wayne, only reason I said that, because they talk about Lil Wayne, and it was referenced that he drinks cough medicine, what you just said, the alcohol and the drugs. It's just, they have so much time to think of how to concoct all this. And it's frightening.
It is.
It's very frightening, and that's one of the reasons why I really wanted to address this today, so that parents become more aware of just the basic common things in their household that these kids are using
Absolutely.
to become drug addicts, alcoholics, however you want to what box you want to put it in, but they're using a lot of different combinations. We'll be right back to All About Us Teen Talk right after this commercial.
Hi, my name is Dr. Tom Dow. We have a multidisciplinary practice in Melville and Ronkonkoma, New York, and we treat patients with many, many different conditions, from newborns through geriatric patients with numerous different techniques. There's a technique and a type of treatment for every class of patient. We have them all here. Here's my son Thomas, also a doctor of chiropractic, working on one of our patients' cervical spine. This patient has had chronic neck pain for many, many, many years, has been to a multitude of different practitioners with little or no response. And with our specialized techniques, she has improved tremendously and continues to improve on a daily basis. We have two practices, one in Melville and one in Ronkonkoma, New York. We are a multidiscipline chiropractic office. What that means is we have chiropractors, massage therapists, acupuncturists, psychologists, all working as a team and a network of outside professionals such as orthopedists and neurologists that we work hand in hand with to help determine what your injuries are and the best way to treat your injuries. I have the great pleasure of having my son in practice with me. We work hand in hand, father and son, to give our patients the best care possible, and a staff which is loving, caring, and you'll never have to wait at all in our office for service. Many times patients come into our office and they have what's called a soft tissue injury. Soft tissue injuries are like scars inside your body. If you've ever been cut on the outside of your body, you get a scar. The same thing happens inside of your body to your muscles and ligaments. So our job is to determine where those are, stretch the muscles, adjust the vertebra back into their correct position, and then refortify the normal structure with exercise. That's what we do best, and I hope someday you'll come see us at one of our two offices. Thank you.
Welcome back to All About Us Teen Talk TV. We're talking today with Miss Jamie Ross from Outreach Development Incorporation about drugs and alcohol. Shay, you have our next question.
What could parents do if they suspect their teen is doing drugs?
Well, I think the first thing, definitely, if parents are suspecting any type of use, I would hope that parents could go and speak openly to their teens. Mm-hmm. So I think it's really important to open the conversation and ask their teens what's going on for them, some underlying things that might be happening for them. Another thing that parents can do is definitely reach out for supports. So some of those supports are community supports, agency supports. We have school guidance counselors, we have school social workers. There's inpatient and outpatient treatment centers that will be more than happy to talk and provide the parents with resources or links on how to approach the situation, because that's the beginning steps, is really just approaching the teen and asking the teen, what is, making them aware that you're aware of the issue.
I feel that some kids don't want to open up that they're doing drugs 'cause I feel like they're going to get in trouble. Because most kids in school, they don't talk to their parents like that or anything.
I think you're right. I think a lot of kids are scared. They're either scared to bring up the issue. B, they're in their use where taking some accountability and acknowledgement that something is going on could be the opening for them, or it's at that point where if they say, yes, I have a problem, now they have to do something about it. And a lot of kids are not equipped with the coping skills to know how to do that. So I think you're absolutely right, is kids hesitate to bring these things, and we find that a lot of parents find out that their teens are using drugs by stumbling upon text messages or stumbling upon information. So I think if you suspect that there is any use going on, look for patterns, look for things that are inconsistent. I know we're going to get into that a little bit, but looking for things that are out of the ordinary from so-called normal adolescence, extreme mood swings, extreme withdrawals, and then addressing those issues as a roundabout way to see what's really going on.
Okay, Ms. Susan.
Once parents realize their teen has a drug habit, how do they break their cycle of supporting their child's habit?
Okay. So once parents find out that there is a drug issue going on, it's breaking that cycle to support the habit. I want to say that I don't believe that all parents actually do support the cycle of use. I think some parents are just unaware. And I think I find in doing some parent groups, particularly at Outreach, we do the parent groups, that the parents will say, I had no idea. I didn't know for years that my child was using drugs. It started at such an early age. So I think bringing awareness to definitely the signs and symptoms of use will help parents be able to see it more with their teens. Breaking the cycle, if there is a parent that is enabling, I call it enabling their child to continue to use by not really holding them accountable or trying to get them to recognize the pros and cons of their use. I think that's when a parent should really reach out for support. There are family anonymous groups, which are wonderful in order for other families to support other families in bringing these issues up. And there are parent support groups. So I think, once again, reaching out for help is a good avenue to start.
Do you have teen mediation groups?
Teen mediation in terms of...
Do you go into different schools and talk to teens about if their friends become involved with drugs or alcohol, how they themselves can be an inspiration to their friends?
We do. I know particularly the outreach development. We go into different school districts. We actually have satellites in some schools that are conducting treatments. We actually have about two or three of them at this moment in schools providing services. So hopefully they're bringing awareness to the drug situation. But besides the satellites being in the schools, we do go and talk with parent awareness nights. I know a lot of the school districts are doing Be Aware or teen awareness nights. And we'll come in and talk to them about what to do and how to reach out, especially with other kids not wanting to bring the drug use to light, but keeping it confidential. And saying, we're here if you want to talk to us, and we'll keep this between me and you, and we'll try to figure out the best avenue in order to get this teen help.
Got you. Sometimes parents feel a huge guilt when they find that their teens are doing drugs, and the only option that they have is to put them out of the home, try to find some way to cut them off or to get them off of that drug. My question is, naturally, parents are concerned because they are still minors. What is the right way to take effective steps to protect their children?
Okay, I think a lot of parents tend to lead with either not knowing what to do or tough love. Let's tell my child, you can't do this. You need to get out of my home if you do this. I think a lot of parents are becoming savvy and aware to the fact that the option to kick your child, I say kick your child out of the home, isn't really an option when they're a minor. There are residential treatment centers, which Outreach does have 2 or 3 residential centers, one being in Brentwood, one being in Richmond Hill, that will take the child in and give them the structure they need to rehabilitate themselves. So that's one avenue. Another avenue is there are crisis group homes or respite centers, that if the parents are in a place where they don't know what to do, and the best option is not this tough love to kick your kid out, is to give a little holding period, or I guess period of respite, so that the kids will have 2 or 3 weeks and the parents will have 2 or 3 weeks to get their resources together. In terms of kicking your child out of the home, I have had experience with parents who feel that is appropriate. I'm speaking particularly more to the minor population, not over 18 or over 21. I feel that if you're sending your child out unequipped to know how to handle these situations, when they're out on their own, they're gravitating towards the people that have supported their drug use. And I find that that's going to bring them sometimes even deeper into their addiction. So I encourage parents to definitely think about the avenue you want to go, because there are so many residential supports and supports that will give you a little reprieve from the issue in order to get yourself and your family together to handle the situation.
At what point, though, is it that you feel that they need to go in a residential treatment facility?
I think it's different for, of course, it's different for every kid. But my rule of thumb is usually if there's a teenager or a minor that's not able to make sound decisions for their safety, at that point, I think the parents need to take an intervention. If it is a residential, I usually tend to see the kids that are moving from outpatient to residential that they've completely lost motivation. They've actually put themselves in extremely serious, scary, or risky situations to their own physical health or mental health. So we usually judge it. We have every child that comes in, we have a different course of action or treatment for them. But when we see the kids putting themselves in risk and the parents are not able to manage it, not because they're not trying, but because it's out of control, is when we say maybe a residential structured environment would give them the consistency they need.
Okay, normally do you try outpatient first at some point before you, I'm asking this question because there's probably a parent right now sitting that's dealing with this. At some point, do I just try to do outpatient?
I think it really, once again, it depends on the adolescent. I think there are severities of drugs and intensity of use of drugs.
Okay.
And I think a professional absolutely should assess the situation. Any outpatient or inpatient you go to, and I'm talking strictly about substance abuse right now, but if you go to mental health as well, they will do a thorough assessment to assess the level and the intensity of use of that child. At that point, I'm hoping that that professional will guide the parent in the right direction. Usually, if you see a high intensity, a lot of use, or the risk is so dangerous, that's when we would tend to go more residential than outpatient. If the teenagers have a level of motivation to make some changes, an outpatient could be actually pretty good in helping a kid reinforce on their self-esteem that they can actually overcome this disease. So
Okay.
I think it really depends.
With all the new drugs in the market today, which one do you think is the most dangerous?
Okay, this is, I get this question a lot. I think this is a tricky question. I'm going to give you a simple answer and then a more complicated answer. So the simple answer is I think the most dangerous is mixing drugs, because we don't know what people are getting. So we talked about before this mixture of cough medicine and alcohol, the lean. So that could be fatal to kids. Not only the mixture of drugs, but overdose in any form or overuse in any form of drug could be fatal. Then there's the withdrawals of certain drugs. I know this might be a shock to some parents and some kids, but alcohol dependency, where someone's using alcohol often, more often than not, the withdrawals of alcohol could kill someone. Also, Xanax, benzodiazepines, the withdrawals of benzodiazepines could be lethal without medical care. So those two. I say my belief is that the mixture of alcohol and benzodiazepines, what we're seeing in the media with all these actresses and actors passing away, there has been some combination of those two. That is very dangerous.
Wow.
For people who don't know what Xanax is, can you explain it to them?
Sure. Xanax is a prescribed drug. It's for anti-anxiety. It's something that could be prescribed by your doctor and legitimately and carefully used with medical monitoring. Although kids, adults who are abusing this Xanax are taking it in excess. They're either taking more milligrams than they should be, or they're combining it with other substances. So it could be fatal.
Okay, we are All About Us Teen Talk TV. We're going to take a quick commercial break and we'll be right back.
My name is Dr. Robert Brevard. I'm here for Multi-Medicine in Westbury, New York. We're located at 1065 Old Country Road, Suite 214. Been here for about 15 years. The practice has medical doctors, physical therapists, chiropractors, acupuncturists. We also do pain management, and we have orthopedists on staff. Here at Advanced Multi-Medicine Rehabilitation, we've got physical therapists on staff who treat an array of conditions, from neck pain to back pain, shoulder pain. We treat carpal tunnel. We treat a lot of car accident patients, slip and falls. We treat patients with knee injuries, with ankle injuries. We have state-of-the-art equipment. We've been here for over 15 years. Vast array of diagnostic testing, from x-rays to EMGs. What is an EMG? It's a diagnostic test that allows a doctor to determine where the pinched nerve is. Cora is a physical therapist at Advanced Multi-Medicine and Rehabilitation. She's working on Stephanie, who was involved recently in an automobile accident. Stephanie has tight thoracic and cervical musculature, and Cora is doing some myofascial release work and some therapeutic stretching, doing it to help her with her pain. Vicky is also a patient here at Advanced Multi-Medicine and Rehabilitation. Vicky is now working her leg muscles, specifically her quadricep muscles, trying to strengthen them after an injury she sustained. If you find yourself in need of any type of physical therapy, please don't hesitate to call Advanced Multi-Medicine and Rehabilitation, located in Westbury, New York, in Suite 214. Phone number is 516-334-7000, or find us on our website at advancedmultimedicine.com.
Hi, I'm Janine Cirilli, and you're watching Madhousetv.com.
Welcome to All About Us Teen Talk TV. We're talking with Mrs. Ross today, and Elizabeth has our next question.
What are other issues that are trending with substance use?
Okay. So there are a lot of issues that come along with substance abuse. One is definitely we see a lot of comorbidity between mental health symptoms and substance abuse. So that is definitely one. Another issue is, not to go into the mental health, but the self-esteem. Low self-esteem, I particularly say low self-esteem, because that is definitely something that could be a precursor for someone turning to drugs to utilize that as a coping mechanism. Three, which is definitely something I wanted to bring up for today. I think as we find the drugs are getting more severe and the drugs are getting more prevalent everywhere, kids are passing away, kids are dying.
Yes.
So we're finding a lot of the issues, the trauma and the grief associated with kids having to deal with other young kids passing away and dying because of overdose or drug use. So I think that's a major issue we are battling in our agency and privately with just the grief that kids as young as 12, 13, 14 years old who know someone who has passed away are dealing with.
Wow.
It's sad.
It is sad. Grief is one of the things that we will address with so much going on between the bullying, suicides, molestation, suicides. It just covers the layers and layers and layers. And I can imagine by the time that you get them and starting to peel it all back, and some of them it's too late for some, and then some is the beginning of reliving a lot of things. And that's the sad aspect of this all. Number 8.
With heroin making a comeback, what are some signs of this addiction?
Okay, with heroin. Heroin is definitely, like we said, making a comeback in prescription pills. Some signs, I would say, across all drugs, there's usually a disease progression. There's a progression, we call it stages of progression. So early stages, middle stages, and late stages of drug use. Some of the early signs of drug use would include, I say very gently, lying, deceiving, hiding. There's withdrawal from family members. So often parents will describe to me, my teenager walked in the house and ran right upstairs, closed the door, and it's becoming more consistent. Not just their teenager is having a bad day. Mood changes, that's definitely an indication. And that goes across the board with any drug. To particularly touch upon heroin specifically, heroin comes with, it's a heavy drug. It comes along with weight loss. There's extreme lethargy, being tired, withdrawn. So those are some common signs you would see. Prescription pills going missing. I mean, that's an obvious sign, maybe not physical, but an obvious sign of what's happening in your home, either selling of the prescription drugs or use of it.
Just a quick question. I know I'm from Maryland. Now, I found out, and I was horrifically upset, that D.C. is actually the heroin and cocaine capital of the world right now. Is that across the nation, heroin is becoming the more prevalent drug?
One of the most
Are we
prevalent
seeing?
drugs.
Okay.
We're finding prescription pill form.
Okay, got
I
it.
think I don't want to strictly say heroin in that form, although opiates in general is definitely something we're battling. That and Xanax.
Okay. With the new drug K2, K3, and synthetic marijuana, what combination of drugs is it made with?
Okay. It is K2, K3, or synthetic marijuana. They have different names for it. Another name is spice. It's a synthetic man-made drug. It's something that chemicals are sprayed over potpourri or incense, leafy forms, or leafy drugs, resembling marijuana. It actually looks like marijuana. And it's chemicals that mimic the effects of THC. So it's like THC or marijuana. It gives this feeling of calmness or relaxation, although there are other side effects that could be very, very, very scary. So we'll probably get into those.
Wow.
And what are some of the side effects of it?
Some of the side effects of K2 are, well, physical side effects are heart palpitations, lethargy, being very, very calm, and sometimes perception and distortion of perception is off. Equilibrium could be off, so where a kid or an adult who was using this would get up, they would see a distorted perception of where they're supposed to walk. And often we're finding, too, with the more intensity of the K2, K3 spice use, hallucinations.
Wow. Do these drugs, K2, K3 synthetic, cause a long-term effect of use over a period of time?
I'm going to say yes, and I'm going to say we don't know. The drug K2 in different forms became prevalent around 2008. In 2008, that's when the drug really actually an outpatient became the drug of choice. We're finding that because it's been so, I guess, short-lived thus far, being only 2014, we can't really track the long-term effects of it, although in 2010, there were documented over about 11,000 emergency room visits caused by the synthetic marijuana, and there have been multiple documented deaths over it.
Wow.
It's very scary.
It is
Very
scary.
dangerous.
Okay.
Are you finding in speaking with teenagers today it is hard for them to
Differentiate.
between a good decision and a bad decision?
I think that's a really good question. I think, once again, I have two folds to this. Between good and bad decisions, any kind of drug use is going to inhibit the development of your brain. So when we're talking about consequential thinking, which is good and bad decisions, we're talking about that part of the brain that is inhibited by drug use. Plus, it's the last part of the brain to develop for adolescents and adults. So I think when we're talking about good and bad decisions, that is definitely one thing that's affected by drugs. Although when you're saying, do kids know the difference between good and bad? I think there are kids that do. I think some kids will weigh out the pros and cons of their use and make their decisions for use based upon that. So I'll give you an example. One example is a kid who uses marijuana to go with their friends because all their friends smoke pot and they have nothing better to do. Well, they have nothing to do because if their friends are using, they don't have any activities. So the socialization piece outweighs the cost and the negative consequences of their use. So I think when it comes to making a good and bad decision, it really depends on the kids, the pros and the cons for that individual.
I just want to add a question to
Sure.
this. As you're talking about the teen that you're treating, that parent who is thinking about that question and who is feeling guilt because their child, they felt as though they were not the parent that they should have been, that their children are using drugs. What can you say to that parent right now?
This is very hard because it is very emotional when parents do come together, and I will say 9 out of 10 parents, if not 10 out of 10, do feel the guilt associated with their teens going down the wrong path. Although, as simply said, drug use does not personalize and it doesn't discriminate with feelings. Drug use and addiction, we call it a disease because sometimes it's out of the teenager's or the adult's hands. And B, it is really a selfish disease in terms of the disease kind of takes over and makes the kids or adults become egocentric, thinking about what they need to do to keep the habit up or to keep this activity up. So when kids aren't I don't believe that kids are deliberately doing this to hurt their parents. They're doing it because they're lost somewhere within themselves and they're finding ways to cope. So I try to give the parents that education to let them know they're not doing it to hurt mom. They're not doing it to hurt dad. They're doing it because they're hurting somewhere. So it gives them that perspective.
Wow. Okay. I was just asking from a parent's point of view,
Sure.
who's setting and looking at this, how can I get through this? What is my role in it? So that's why I was trying to come with that question.
Sure.
All right, Miss Shay.
Today, teens are finding a variety of new choices and different viewpoints that are challenging the values that their parents taught them. My question today is, my question is, are teens finding it easier to use drugs to fit into certain peer groups?
I definitely think that the socialization and fitting into peer groups is a major component. I wanted to highlight, because we did mention this before, I wanted to highlight particularly females and substance use. I think with the social media, the tendency for teenagers to want to fit in, be thin, be model-ish like, could potentially, the outcome could potentially be them using drugs in order to attain this false image. So I think, and that goes for different types of images that teenagers are looking to have. And I think they believe that the ones that use the substances will help them attain this image, when in reality it's really not. So yeah, I do believe.
With the females, are you finding a lot of them are coming with that low self-esteem, no self-worth, no value, they have no vision, they just believe that they were just born for nothing? Is that what you're finding with a lot of these? Do you have a sense as to why this is trending like this, or?
We do seem to believe that there is a trend due to the societal pressure, the correlation between that. But we're also finding that girls, sometimes girls and boys come with histories of trauma, whether it be sexual trauma or because of drugs, putting them in a risky situation, things happening to them, and them not knowing how to handle these things, which definitely decreases their self-esteem and their self-worth when they're putting themselves in negative situations that they have no control of once they're intoxicated.
Wow. We are talking about drugs, and we're talking with Ms. Ross, all about us, Teen Talk TV. We'll be right back after this commercial.
Welcome to Formula Auto Wash, where every day is a great day for a car wash. Open 7 days a week from 8 a.m. till 5:30 p.m. Sundays 8 a.m. till 4 p.m. Detailing packages for every budget, starting out at $29.99. 100% hand wash and detail centre. Hot hair and microfiber brushes and mitts. Proudly using Ecolab Blue Coral soaps and waxes. Formula Auto Wash has served the community for over 30 years. Senior discounts all day, every day. Ladies' Day Wednesday, $3 off any wash. Early bird discount Monday through Thursday till 9:30 a.m. Check out our website, formulaautowash.com.
Are you planning an event and want to include entertainment, but you're not sure where to turn? Act1Entertainment.net has provided over 1,500 events with quality, affordable live entertainment at private parties, corporate affairs, festivals, bike rallies, and more. Act One will fit into your budget. They're friendly, reliable, and do all the legwork for you. They take all major credit cards. Log on to Act1Entertainment.net for a free, no-obligation price quote, or call 631-758-3505 for a brochure. You'll be happy you did.
For professional motorcycle transport and towing, think Kickstart Fabrications Motorcycle Towing. Proudly serving all of Long Island, we feature expert handling and 24/7 service. So send a limo for your toy with Kickstart Fabrications Motorcycle Towing. For professional
Hi, I'm Janine Cirilli, and you're watching Madhousetv.com.
Welcome back to All About Us Teen Talk TV. Again, I need to give you our Twitter. It is CJ at AAU TV Radio. If you want to tweet us a question, to ask Mrs. Ross before we leave, you can tweet us through CJ at AAU TV Radio.
In talking with the youth, with using drugs, during them using the drugs, do you think that they use it as a coping mechanism or for negative life events or situations that they cannot control?
I think teens definitely utilize drugs for coping skills for many of reasons. One you were mentioning would be things that they can't control. So we go back once again to this societal pressure that they can't control. Another thing could be mental health diagnosis, which we really didn't touch upon too much, but going into things like ADHD or anxiety or depression, real things that kids are struggling with when they go into schools or they're walking around with their friends and don't know how to cope with. I think kids would call it, and parents would call it, self-medicating. when they're using, let's say, marijuana to calm down their anxieties or some of these feelings. So I definitely look at drugs as a coping mechanism for whether it be something in their control, out of their control, pressure that they feel, or as simple as mental health diagnoses that are going untreated or undiagnosed.
At what age do you find teens start using drugs?
It's a good question. I get very sad speaking about this question because if you ask me about 8 to 10 years ago, working in the outpatient, what age we saw come in, I would say it started around 14, 15. Now I could say, unfortunately, we're finding, fortunately that they're getting help. Unfortunately, it's starting so young. We've had referrals as early as 10 years old. On average, I would say 12 to 15 we're seeing as young as. And that could be, we're talking about an outpatient setting where the use could be minimal, it's just beginning, and parents are really lucky to have been informed, aware, and have caught it. And then there's sometimes there are older kids that are coming in that have been in their use for multiple years.
Is that among a certain economical or ethnic group that you're finding that lower in age, 12 to 15?
No, I'm actually going to, I've thought about this and done a little research about this as well, and you know, my go-to answer to that is that drugs are not discriminating right now. Okay. We are finding that in different SES or socioeconomic statuses, different types of drugs are more available. But for kids with certain ages, we're finding that it doesn't discriminate. We have ages, different ethnicities, different ages, different SESs.
Okay.
Do you see an increase of percentage from 1990 to now?
Absolutely. I could say I wasn't working in substance abuse in 1990, but when we did start the outpatient programs, I could say that we probably had, and I kind of smirk about this, about 10 to 15 kids now across multiple sites and inpatient and outpatient. Well, let's go with the outpatient. We have well over 100 kids, and that's only during one cycle of treatment. So the treatment can last anywhere from 4 months to 6 months. It's a lot of kids.
Are you finding that those kids that are going through the cycle, are you finding them to be repetitive?
Repetitive.
Are reoccurring? Are they coming? Do you see them again and again and again? Are some of them really breaking their cycle of drug abuse? Are you seeing this as reoccurring, or some of them are really going on and once they're treated, they are healed? You know, they can move on.
I could say, based on what I've seen and based on the research, about 2 years ago, I was talking to the parents in terms of how many, on average, how many treatment episodes, whether it be counseling privately or treatment agencies, on average, about 5 treatment episodes in order for a teen to reach a place of understanding the impact of their use. What we're seeing in the outpatient is I have seen reoccurrences, although we have had many successes. And the successes, I'd like to think, we actually have had parents and teenagers come back to the agency to show how well they've done. They're in college, they're attaining jobs. So with the support, I'm hopeful to think that there's a good turnaround of successful cases. And particularly with the adolescents, the earlier you intervene, the more successful they will be.
Wow. I've already asked question 15. At what point do you suggest inpatient versus outpatient for therapy in treating teenagers? We already went over that question, so we're going to move on, Elizabeth.
Or what are some of the underlying factors for teen drug use?
Okay. So I'm going to say the one we've said a lot is societal pressure. I'm going to say self-esteem. I'm going to say underlying mental health diagnoses. One that we often forget is a history of substance abuse in the family. So as a family therapist, tracking the substance abuse patterns if there is substance abuse, predispositions your adolescent or teen to be more susceptible to some sort of addiction. And boredom. We forget that. I hear this, I heard it yesterday, I'm going to hear it today in some sessions, is that I'm bored. And even though we have a lot of resources, there are limitations to kids, especially ages 12 to, let's say, 15, with not being able to drive and have accessibility, or even work and have the money to do so. And with the economy not providing as many jobs for young teens, it is difficult for them to get involved in some structure. So we really encourage the boredom to get involved with volunteer positions, school activities. That's really where it has to happen right now.
Wow. I'm just blown away just by the information that you have given us, the numbers. Let's talk about social media just a little bit.
Sure.
Are you finding that kids are being bullied more? I'm going to change the subject just a little bit.
Yeah.
Are you finding that they're being bullied more by social media or being bullied in the schools?
I would probably say here both. The social media is definitely, I find, an avenue from what I'm hearing from kids to protect themselves from being the perpetrator. So I think it is easier for kids to cyberbully in terms of whether it's texting or tweeting or Facebook posts. There's so many different avenues to do this. And I think it takes a lot of the emotion out of it, where kids don't feel as guilty over doing something like that, and don't truly understand the impact it has for some of these teens. So I think it's almost scarier to know that the cyberbullying is very prevalent, whereas physical bullying hopefully could be caught with monitoring in schools and the society around you.
I was asking that particular question is because most of the cases that you get with teens taking, going into drugs, is it due to bullying? I know that has something to do with it, but are you finding that pressure is so surmountable that they just suppress their pain with the drugs?
Absolutely. I think that is one definite component of if a teen is being bullied. Kids not wanting to talk about that, particularly not wanting to bring the perpetrator, I say perpetrator, the person who is bullying, to light because of the ramifications that they might have. So teenagers will commonly withhold this information, hold it in, and internalize it, along with other issues or concerns that might be difficult for them to talk about. So absolutely, and turning to drugs is a common thing we see.
We want to thank you, Ms. Ross, for coming today. Thank you for being very informative.
You're welcome.
I've learned a lot more today than I thought I knew when I was coming in here. So I have been very informed. Can you leave your information so if someone would like to reach out to you,
Absolutely.
contact you?
I'm going to give multiple information, multiple different places. One privately would be Smithtown, and I can leave my email address.
Whatever.
Is Jamie Ross, lmft.com. That's my website, and my email is jamie@jamieross.lmft.com. The other avenue is you can look into outpatient services, residential services, in-school services for substance abuse, and we do have the capability to manage mental health issues along with substance abuse issues at Outreach Development Corporation. They have a website, if you just Google Outreach Development Corporation, and you'll find links to all their different programs. And you could definitely reach us at any of those avenues, and we look forward to hearing and getting any questions to help the youth of our society.
Thank you for joining All About Us, Teen Talk TV. Don't forget to order your magazine at www.aaUYM.com. We'll be back again next Thursday. Please join us and have a great evening.